All right, guys. So now what we're explaining is the NKT portion. This is a NeuroKinetic Therapy. So again, this is a muscle testing. We're kind of seeing how her brain is communicating with each muscle. Since her concern is with her neck and the forward posture, we're actually going to check one of the main muscles that contribute into the forehead posture that gets really weak, which is the longus colli. And then on the opposite side, a compensator you get a lot of the times is your scalenes or your SCMs or the sternocleidomastoid. So first and foremost, we're going to kind of set her up. We're going to want the palms facing up. We want this joint, which is the glenohumeral joint, we want it up. Okay. Also, what I'm just going to do real quick is just get her feet nice and straight. Okay, so we're just, at this point, all we're doing is just aligning her, making sure that we're getting a good communication through brain and muscle. So the first one we're gonna do is, I'm gonna have you tuck your chin. Now, any of these movements, I'm gonna put you there. You're gonna always resist my pressure, just matching it, okay? Mm-hmm. And you start on an exhalation. So you breathe in, and then on the exhalation, we'll do it. Yeah. Got it? Okay, so again, this is testing the longus colli. So what we're gonna do is have her tuck her chin, because that is the action of that muscle, tucks the chin. And now we're gonna have her lift up her head. Okay, now at this point, I'm going to ask her to hold it there. So go ahead, hold it. Now I want you to breathe in through the nose, out through the mouth, and match my pressure. And as you see, her neck is really struggling to keep that up. And also, I'm not sure if the camera caught it. I mean, I definitely did. But these SCMs basically fired up. So that's telling me that they're kind of taking over and taking the work. They're working for this longus colli. Okay? One thing we do want to make sure of, usually when these front anterior neck muscles are very tight, there's a good chance that this person is probably not breathing enough to the diaphragm, which is very important. All of these muscles that I explained, the scalenes, the SCMs, they're actually secondary muscles. They aid in breathing. But we don't want them firing off all the time, because that's not what they're meant for. They're meant to aid and not to be the primary workers. So what I want you to do is put a hand on your chest, right there, and I want you to put a hand on your belly. Now, as you breathe, I don't want you to feel this moving at all. I want the breath going directly through the belly. So go ahead, go in. Perfect. And you see, this is almost filling up like a balloon. And you're going to want to fill it as much as possible. Okay. Now, for her, it's funny. It's almost a trick movement. Through habit, she's used to breathing more through the chest. That as this starts inflating, maybe 60% of that's going, the rest now takes over. So at this point, this is something I'm going to say, Chloe, now you can go home and practice this, okay? Set a timer for about 5 minutes and start breathing through the belly. And this is just a good way to get the brain to give these guys a break, okay? Another thing we're going to do, put her back in this position. Here's another NKT. So we're starting off assuming that the SCMs are overactivating. Let's test them and let's actually see if that's the truth. So we're going to put her here. We're going to turn her head this way. You're going to hold that up for me. So this is the SCM, this big muscle right here. So I'm going to have you hold your head there. Now again, breathe in. And breathe out. Okay. Did that feel like it was really hard to hold up?
It was.
It was?
Yeah.
Okay. Let's try this side. Really try it. Okay. And you see that one's firing off pretty good. So there may be some asymmetry, okay? Now we're also going to test one more muscle, which is the levator scapula. So let's go here. Let's tilt the head back. We're going to actually cock this shoulder up a little bit. And now do not let me separate you, okay? Breathe in. Breathe out. Solid. Okay. Let's try the other side. Up here. Up here. Breathe in. Okay, so again, all those tests, nothing really stood out a red flag. Again, the one that did stick out the most to me was the longus colli. That's letting me know it's not firing off. So at this point, what I'm going to do is actually give her a corrective exercise, okay? So here's what I want you to do. You're going to put your hands right here. Now with these fingertips, you're going to touch that SCM. And how do you find it? Go ahead, lift up your head real quick, like if you're going to look up. You see how they fire up? Perfect. So they just fired up. So now you've located them. I want you to just push them right there. Now, what you're going to do is you're going to try to perform a chin tuck. Very slow and controlled, but these muscles should not fire off. You follow?
Okay.
So you're going to be able to tell me. So let's get back into your position. Having your fingers here, you're going to go ahead chin tuck. But again, these muscles, the SCM, should not be firing off at all. So let's see what happens. So go ahead, tuck.
Oh, it fired.
See, so now this is, again, it's kind of just reassuring me that these SCMs are just very overworked. And at this point, what I would be doing first is kind of getting a release through here and then having her take home some corrective exercises where now you are tucking the chin. And again, the reason we're tucking that chin is to strengthen the longus colli. Neurologically, we want that longus coli working for itself and not the SEM working for it. So it should do every muscle should do its own job, okay? And if you think about the forward head complexion, we normally go forward and then up. So at that point, suboccipitals, which are these muscles back here, they get tight and cause her to do this, okay? So again, think of you guys sitting in a computer. Happens all the time, all of us. We are stuck in this position where we're rolled forward, head goes forward, and you're staying here. So a lot of muscles, especially in this anterior portion through the neck here, they get tight because you have them in a closed. And then on the opposite side, the reciprocal side, all of these muscles in the back, so rhomboids, paraspinal muscles, inferior and medial trap, they become very weak. So these are all things that we can test. And then once these tests give us a clue, then we know what we need to do next. Okay?